On the 25th of August 2020, the WHO African region was certified as free from wild polio after 4 years without a case in Nigeria, the last African country to record wild polio cases. Nigeria accounted for more than half of the world's wild polio cases since 2012, which is why this news moved the world closer to achieving global polio eradication. But why was Nigeria the last African country to have wild polio cases? Wild polio is an infectious disease caused by the polio virus. The disease leads to muscle weakness, paralysis, or reduced muscle tone, commonly affecting the legs over a few hours or days. Some cases last longer and fewer result in permanent disability or death. About 25 years ago, thousands of children in Africa were paralyzed by the polio virus as it spread in communities through contaminated food, water, and person-to-person contact, with children under 5 being the most vulnerable to the virus. By August 2020, 95% of Africa's population had been vaccinated against polio when efforts began in 1996 through a campaign led by Nelson Mandela. This is why African wild polio cases fell from 75,000 paralyzed children in 1996 to 0 cases in 2020. But before the cases were officially tallied as 0 in 2020, in 2019, Nigeria became the only country with wild polio on the continent when Kenya, Mozambique, and Niger were declared polio-free after 2 years of not recording any cases. Nigeria was also on track to becoming polio-free until 4 cases were detected in mid-2016. Unlike Kenya, Mozambique, and Niger, the wild polio cases in Nigeria were in remote and politically unstable communities, specifically in Borno State, which is also the epicenter of Boko Haram insurgents, making it very challenging to deliver health services. When these cases were detected, it became clear that Nigeria could not be declared polio-free until more vaccination and better population surveillance was conducted in Borno State, a state with communities that had not received any vaccination efforts in years at the time. This focus on Borno State was important because declaring any area as polio-free requires 2 things. 1, no cases should exist in the area, and secondly, the majority of the population in that area also needs to be vaccinated on record, which was the big problem with Borno State. Fast forward about 4 years later, in 2020, wild polio was finally declared as eradicated in Nigeria and effectively in Africa, after thousands of volunteers were committed to vaccination, education, and population surveillance efforts in Borno State, Nigeria. And although vaccine-derived polio cases still exist across the continent, the vaccine-derived poliovirus is weaker and it originates from the vaccine itself. Oversimplified, a vaccine basically gives someone a weaker version of a virus to better prepare their immune system to fight off the actual virus. This weaker version can still be transmitted from immunized people to those who aren't vaccinated, and those are the only existing polio cases in Africa. Eradicating wild polio wasn't just a breakthrough for Nigeria and Africa, but the entire world, because only 2 countries worldwide continue to see wild polio virus transmission: Pakistan and Afghanistan. This public health milestone has gone largely uncelebrated, despite it being a journey that started in 1952, when the first polio vaccine was developed. The global community has responded to the COVID-19 pandemic in a fraction of that time, which puts into perspective how much global public health has improved. Hi, thanks for watching. We have more African news stories for you and a brand new one each week. Subscribe if you like learning and thinking about Africa.